For most Americans, there are two basic government-sponsored social programs that people think of when it comes to health care for seniors, Medicare and Medicaid. It's critical to understand the differences between the two programs to appreciate the fact that Uncle Sam has no real plan for most Americans' long-term health care needs. Medicare is a health care payment plan for persons age 65 and older that comes in several parts. Part A covers hospitalization, Part B covers physician expenses and outpatient treatment, and Part D provides prescription drug coverage. But keep in mind that Medicare is a health care plan for seniors, as opposed to a long-term health care plan for seniors. Basically, your Medicare-paid treatment terminates for hospital stays and skilled nursing care stays exceeding 100 consecutive days. Now, most of us have never spent 100 consecutive days in a hospital or other skilled nursing care environment, so that may sound like a long time. But when you consider that the average length of stay in a nursing home is 2.4 years, the cost of paying for long-term health care without benefit of Medicare after 100 days is indeed financially unsettling. Further, 70% of those persons aged 65 and older will at some point in their lives require skilled nursing care. Medicare also does not pay for what is called custodial care, non-skilled personal assistance with bathing, dressing, eating, transitioning in and out of bed, moving from chair to table, and using the bathroom. Most long-term care is custodial care, and when that's all a senior needs, they are on their own to pay for it. Medicare doesn't cover it. Medicaid, on the other hand, is a long-term health care plan sponsored by the federal government and administered at the state level. Medicaid essentially requires that you impoverish yourself to receive long-term health care or custodial care. In most states, excluding a house, a car, and burial insurance, you cannot own more than $2,000 in assets, and you may not have an income more than about $64 a month. Anything above that will go toward paying your long-term care. For those with minimal assets and modest income, Medicaid is a safety net to ensure that they receive the health and custodial care they may need in their later years. For persons who have a significant amount of wealth, Medicaid is usually not even a consideration because those persons will pay for whatever long-term care they may need out of their own pockets. For the rest of society, it's a tight squeeze. Without important pre-planning, seniors may find themselves spending a significant portion of their wealth on nursing homes, or having to spend down assets or transfer title of them so as to qualify for Medicaid if and when the need arises. That's why even with Medicare and Medicaid, Uncle Sam has no long-term care plan that works well for most Americans.